Doctor.
Thank you. And good morning, and I'm grateful for the people that took care of me so far and made me come. And thank you for allowing me to share. The topic is mindfulness in education, and it seems that this word, mindfulness, that was usually in the East, is now very prevalent in the West, and we'll trace it in this presentation. And not only the word, but the meaningfulness behind the word and its significance, potential significance for education, for children, for teachers, for kindergartens, for higher education. This is what we shall attempt to do. And if this one would work, then one of the ways about mindfulness, which is usually good to recall, is I like this Thich Nhat Hanh's quote, the Vietnamese old teacher and poet and author, and he says, as we can recall, the present moment is where life can be found. And if we don't arrive there, we miss our appointment with life. In order to remember it not only mentally, I would urge you to just notice your sitting and bring your sitting to be more grounded, very simple. We are all sitting except me standing, or most of us sitting. Then bring your sitting to be more grounded and invite the ground to support you. You can even recall situations where we need to be supported in life. And then we can take one breath in, inhaling, and telling to ourselves, I'm breathing in. And then we can exhale, breathing out, and telling ourselves, I'm breathing out. And if we would do it with eyes closed, we can even tell the breath, I'm here, I've arrived, I'm home. And almost resonating and imagining the breath is telling us, with each inhale and exhale, like a wave in a cave, I'm here too, I'm alive, I'm home. And which direction am I supposed to point? Which direction am I supposed to point? Your direction? Battery? Direction? God? No. Okay, I'll try again. I need to aim. So a very brief history. This is from a monastery in Australia where I gave a presentation some years ago, and there was this baby Buddhas were all around the monasteries. Just a quick recall. In the past, there was the West and there was the East, and there was not much connection between them in the world. The East was in the East, the West was in the West. The West was inventing different technologies, electrical bulb and locomotives and airplanes, and the East was invested in inner technologies. And there was not much communication happened until the 60s and the 70s, when the West leaked to the East and the East leaked to the West. And the Dharma, among other things, arrived to the West. When the Dharma arrived to the West in the 60s, 70s, it was mostly for some strange people who were in the West, that were into Buddhist Dharma, Buddhist meditation. It was not all over the place. And then about 40 years ago, the Dharma shifted to therapeutics by an American person named John Kabat-Zinn, and he figured this Dharma work and this meditation experience based are very therapeutic. And he brought the Dharma and the meditation to hospitals. And then it moved on to psychotherapy. And then about 20 years ago, it moved into education, which is why we are here now. it's kind of paradoxical. When I gave a talk in this monastery and university in Australia, the nuns in the monastery took me after the presentation to get my help, to help them understand how can they teach children mindfulness, which is, mindfulness came from the East all the way to the West, from the West to therapeutics, and then to education, and then to Israel, and then to me, and I'm now in Australia in a monastery, Dharmic monastery, and the nuns want, it's like the world is becoming very integrative, using Tobin's word again. Okay, let's see. No? Yes. Now when the Dharma began to leak to the West in the 60s, I was a child, I was a teenager, and my main interest was airplane, how to create models from small kits. If you remember, it's still around. You get many plastic kits in a two-dimensional box, and you rearrange them, and you create an airplane, a three-dimensional. This was one of my favorite. And as you can see, I was practicing integration and creating a whole that is bigger than the sum of the parts without even knowing it. I chose aeronautical engineering in the 70s, and then I stopped. I practiced as an engineer for 5 years. And then I did some travels, and then I moved to long and deep interest in natural medicine, in mind-body, in yoga psychology. I went to the States, I studied natural medicine and became a mind-body expert. With a colleague, we designed the course. This is 1984. We taught a course in the medical schools in the States about healing, consciousness, and transformation, investigating what holism is about. It was more for physicians, not for teachers then. And for physicians, we sort of stated and tried to express to the physicians and the students becoming physician that we can somehow in therapeutics touch something deep in the person and help the person, the patient, touch something deep in himself or herself. And that can be much more important than finding the right remedy. A field was then created called Integrative Medicine, which is now in textbooks like this one from 2003. And there's something that I will relate to in the principles of holistic or integrative therapeutics, and they remind, this is for physicians, when we see a patient, we need to address the whole person. Not only the illness, not only the pain, not only the disease, not only the bacteria, not only the cholesterol. We need to address the human being. And when we address the human being, there's body and mind. When we address the human being brings some capacity, inner capacity and resource that can influence the healing. And when we address the human being, we need to relate to the human being as a human being, and the term in English is relationship-centered care. And the patient in this equation is not only agreeing to receive a surgery or an acupuncture point, a needle, or medication. He is more engaged, he is more involved, he or she. They can contribute to their healing process. And everything is about creating an environment for healing to take place, physiological environment through movement, immunological environment through nutrition and herbs, psychological environment through communication and expression of feeling and needs and or meditations, etc. And then there are different therapeutics that are trying to resonate with the deeper principles. And the same can be done in education. This is something I figured, and I began to lecture about it to educators in the 90s, that in education we can very much practice the same. My follow-up presentation after lunch, I think, will relate to that in more depth. In education, what we are trying to do, what we need to do, what we should do, is relate to a whole person care, whole child and whole teacher. In kindergarten, it's done more spontaneously. In primary school, less. In high school, even less. And in higher education, even less. It's like a negative sliding scale. We can remember that the child wants to learn and can learn because that's how we learn to walk. That's how we learn to talk. Learning is in us from birth. It's in our DNA. We need to learn, we need to want to learn in order to evolve and even simply survive. We need to relate to the child, and so we need to create a schooling that in which there is a relationship-centered schooling. We need to, or we can, we don't need to, the principles, we can connect children to the inner life. Children can do that too. And we can create mindful learning and create not only a space for healing to take place, but for deep learning to take place. Creating a learning environment. And then using integrative pedagogies and integrating different pedagogies that resonate with the core principles. And when I gave this lecture, the school principal came to me and she said, I have a budget, my school is in a bad shape, we have violence and the grades are terrible, I want a full program. And we knew a full program is not easy, a whole school is not easy. This was 20 years ago. And we knew that when we work with a child, children are not easygoing in the modern world. There's more and more in the world attention and deficit problems, more and more emotional and behavioral problems, more and more depression, anxieties among children, among teenagers, lack of meaning, more and more bad choices that usually young adults are doing, not choosing the right choice, risk behaviors. They risk themselves, they risk someone else. Eating problems, overeating, overweight, which is a risk factors for many more problems later in life. We have lack of physical activities except the fingers that are still with the iPhone, as Tobin mentioned. And unfortunately, academic achievements are not up. They are going down in many countries, including the most technological countries. The academic success is downwards. There are a few exceptions. And by now, this was 20 years ago, and now around the world, this list is only a small list of what's happening in the world in the area of mindfulness and education. Most of these programs started in the last 10 years and are growing and expanding and multiplying, and each one is a different model. In different countries, each country has its own model of mindfulness and education. There's the Israeli model, which is 45 minutes once a week, and a few small ones on top of that. There's the Australian model, which integrates many, many different things, not only meditation, but also playfulness, in Israel too. There's a .B program in England, which is only 10 weeks classes, with a lot of description, lots of didactic, but fun didactics for the children, and a few very short experientials for the children. There's the Pause, Breathe, and Smile in New Zealand, another program which integrates mindfulness with the old traditions of New Zealand, the wisdom traditions of the New Zealand original founders, the Maori tribes. There's the Wake Up School coming from Thich Nhat Hanh in Europe, in France. There's GNH, Gross National Happiness in Education in Bhutan, where mindfulness is part of the package. And then there are more and more schools who are interested in positive psychology in education, resonating with mindfulness. There are centers, including Hong Kong, Bangkok, Japan, resonating with mindfulness in different ways. When we started to work with children, whole school, I had to investigate children. I never learned. I learned about illness with adults and not about educating children and improving their well-being and development. So I had to go to the books, and I found a few notes that will be, I think, good to know. We kind of know it, but it's good to know specifics. This is from a book written by an American child psychiatrist in the 80s, and she reminds us that when we have a child, we have 5 inner drives, 5 inner needs, 5 deeper needs. She named it urge, which is stronger than a need. And she said, every child wants experiences, obviously positive ones. And that's how we learned. We learned from experience. Every child has an urge for wellness, not to know what wellness is, to experience wellness. Everyone who has been with a baby knows the baby immediately tells us when something is not well. And we need to guess what went wrong, to feed or to move or to put a blanket on or to take too many blankets off. We need to figure out what's not well and to address it. Every child wants to be a little master with mastery, ability to do. That's how we learn to walk. We wanted to be able to walk, and here we are walking. That's mastery. Every child wants social interaction. Usually the mother, the father, or the grandparents are the first to address that. And every child, she said, that's an unusual statement, have an urge, more than a need, stronger than a need, for the world of imagination. So when we designed the program, we thought, okay, how do we address that in mindfulness? Because mindfulness can do some of it. How can we have mindfulness relate to all of the above? We also knew from the Journal of the American Medical Association about risk behavior. This is from a study done in the States and published in the 90s, assessed 12,000 young adults about risk behaviors, alcohol and drugs and violence and suicidal thoughts or suicidal efforts and very early misuse of sexual behavior and other potential dangers, and they found that the main protector is the sense of connectedness, which can happen at home and or happen in school. In school is a big opportunity because we have kids for at least 12 years. If we are able to give them a sense of connectedness, which is to themselves, to their fellows, to the teachers, to the school itself, to life, connectedness to life, all that we can potentially do. And again, the thought is that we had, how can we use mindfulness to make that happen, to enhance that? And then at the same time, a big study of the World Health Organization was published, and overlapping in a way. And what they found in a big study in Europe and the Middle East about young people's well-being and resilience was 4 factors are needed. Positive experiences, overlapping what we have said, significant adult that can appreciate and can listen and can set boundaries and can direct, sense of value, and social connectedness again. I won't go over that, but that's a chart that was published in the States about social emotional learning, very similar issues, self-awareness, self-regulation, social awareness, regulation in social consequences like conflict or a group, which is more difficult to handle, and right choices. So when we began, we quickly realized it's very supposedly simple but not easy at all. How to take children, 35 in a class, school of 350, let's say, and expose them week after week after week, like a topic, to everything. Mindfulness is actually being intimate with everything, with the posture and the breath and the thoughts and the emotions and the movements and the sounds and the walking and the eating and someone else. All that we can design potential experientials that address that and help the child to befriend as much as possible everything that is actually experiencing in life in a structured way, in order to be with everything in a different way, with more compassion, with more sensitivity, with more curiosity, with more patience, with less judgment towards everything as much as possible. And how can we use imagination, and how can we use interaction? Because mindfulness, if we close the eyes, we sort of become detached from everyone. How can we use both channels, the introverted and the extroverted, connecting to oneself and connecting each one to each one? How can we use inquiry? So it's not only silence, but use questions and answers and artistic expression of the experience. And like breath, if we feel the breath, where's the breath coming from? Simple question. The breath in history, okay, first Adam and Eve, God, the first thing that God did was give breath. Where did God, according to the legends, breath? Nostrils. Okay, can we feel the nostrils, the breath coming in and coming out? That's more concentration, etc., etc. Raising questions, creating dialogues, having artistic expressions, and mostly trying to make them think, where can they apply that? Where can they take it to? Where they can use it in life circumstances, in daily life? You do it? So you do it. I thought I'm competent. And what we saw was that now we are 20 years later with more than one school, and I've been around with many of these other programs. We can do that. We can take children, and we need to do it right. We need to use integration. We need to use intuition. We need to use wisdom. We need to use knowledge. We need to use science. There's a lot we can use, but the final point is we can take a child and enhance his or her self-awareness, which is great. Awareness to the breath, and to the emotions, to the sensations, to the pain, to the drives, to the urges, to the violence inside. Even by making a child aware of it, he will be more able to have freedom to choose. We can help them to be more efficient in life, effective in life, resilient in life. It seems that that's more and more important in the world of the future. We can help them cultivate the qualities of the heart: gratitude, forgiveness, appreciation, thankfulness, joy. And the program can include that. We can develop through mindfulness social emotional skill. It's not the only way to train social emotional skill, but even mindfulness, the silent version, if we do it right, can enhance social emotional capacities. We do prevent risk behavior. We see that now 20 years later. We obviously support their mind-body health. In some of them we can see for sure different small transformations happen, and learning is improved, that's for sure. Whole school approach, we can use the World Health Organization definition for health promoting schools. This is a 1996, I think, definition, health promoting school. And it's involving the children, involving the parents, involving the teachers, involving the culture, involving the curriculum. In different places of the world, only pieces of that are happening. Only the teachers learn, but the children don't even know that the teachers are trying to learn mindfulness, but skipping the curriculum, skipping the children. In some places, only the children and the teachers are the same teachers. That's not always good, at least in Israel at least. The teachers to be the same teachers, it's not always for the benefit of the children. We, in Israel, we do we work in a class with no furnitures, and there's a lot of ability to come to the child. And if the child is restless, we just touch and we say, oh, I see you're restless today. That's okay. And the touch immediately is calming, obviously, to the nervous system. We use different postures, sitting, sometimes even tapping to bring energies. So not everything is quiet, quiet, peace, peace. Sometimes we need to energize children. And then we make them stand up. Or try to do that at home. Equilibrium, very important for the nervous system, and that gives them challenge, because mindfulness, children likes challenges. So we introduce them to challenges. Standing, laughing can happen too. Wouldn't hurt for children to obviously to laugh at school. And then we have final mindfulness on the ground, on the earth, with the body, and the air supporting, and the breath, and scanning the body sensation. And then one by one, we tap them, and they leave the class. And a few of them will fall asleep. Just a few quotes, just I have many, I have hundreds and hundreds, because we kept collecting children's reflections in the last 20 years. So I'll just share with you just a few children's reflections. I hope you can appreciate the child expressing something here, like this one, during the class. So this is during the class. My tensions pass away like clouds in the sky. You can do a little imagery yourself and imagine your tensions pass away like clouds in the sky. And I love the class, because after each class I feel the calmness and goodness in myself. When I was her age, I didn't even know what calmness and goodness are. Definitely not in myself. Or mindful learning, what did she learn? Or what does she think is this learning for? And she said, another one, the mindful class helps because it teaches things that everyone needs to know. I have no idea how she knows that this is something everyone needs to know. Such as how to breathe, and how to rest, and how to relax, and how to be quiet, and how to imagine, and how to discover the peaceful places within. And that one, for 1 year, she was one of the most obnoxious one, the more difficult one. And only in the second year, transformation happened. And this is what she said after the second year. She said, in the beginning, I thought all this was it's very stupid. Why do I need to relax if I'm so relaxed anyway? What's the point? But then I started to listen to the instructions. And something happened. I became a different person. That's her statements. I became peaceful and I became friendly, and I realized how angry I was and how much harm I caused, because I couldn't say no to myself. I could not stop myself. Now I can. And for me, this is huge, to make that happen in 2 years. Or you can just appreciate the richness of the expression here. This class taught us about health and breath and the body and the movements and the moments, and about helpful concentration and peaceful thoughts and serenity in the mind, and about stillness and exploring inner world and images that can guide us to our safe and peaceful places. And so we figured what now it's kind of obvious to me, but I didn't know it for 15 years. But now it's so simple, it's so obvious. We need to explain children something about mindfulness. It's good that they cognitively understand, or compassion, or just stay grounded, rootedness. When do we need to feel rooted? When do we need to feel supported? We need experience, good enough, meaningful enough, curious enough, unusual enough, calm enough, etc. Self-expression is important after the class or in between classes. Inquiry is important after the class or between. And application, so they take it home, not as a homework, but as a tool, as a toolkit, as a skill they can take home. And the outcomes, some of the outcomes are just good experience. Some of the outcomes are insights. Some of the outcomes are tools. Some of the outcomes are skills, more empathy skills. Some are new habits. We're just able to create new habits to replace bad habits. How do we know we do it right? Because the second school where we started was very high violence, low grade. That school became the top 3 in Israel, in grades and in no violence. In Israel, both are being measured every 2 years. To our support is coming the OECD, the famous European, which is actually global organization for economic cooperation development. And they created a position paper this year. And they said, those are the guy up there, the non-holistic people who are interested in economics and survival. And they said in Europe, and it's for all the world they said it, that we need to help students develop curiosity. We need to help students develop imagination and resilience and self-regulation. We need to teach children to appreciate others, including different others. We need children to be able, we need to teach them to cope with failure and to have resilience to continue despite failures. And we can teach it, they suggest. Teaching that is not through lectures. And we should, they said, we should motivate children to care about themselves, about their friends, about their families, about their community, about the planet. And this is what we are here for. Just a few quick slides. So education for me is the best treatment, prevention and optimization. Mindfulness can help us do that. It's not the only way, obviously, to treat. Some children are almost needing some sort of treatment, and we can prevent a lot of damage, and we can optimize their life for the future. If we optimize their life, we optimize the world of the future. We prevent risk from the world of the future. Obviously, that's not always easy. This is a big task. So I like to remind myself, and I bring her in, the Mother Teresa, who said, we cannot all do great things. That's impossible. But we can do small things with great love. And because change is difficult, I always use this slide because change can happen, and because this is me as much as it can be seen. This is me in 1980. And you can see change did happen. And it's a little for the better, maybe. Thank you very much.
ขออนุญาตถามเป็นภาษาไทยแล้วกันนะคะแล้วเดี๋ยวจะได้ฟังกันทุกคนคือรู้สึกประทับใจนะคะที่Professor Sheinman ได้ทำพรีเซนต์ให้เราเห็นถึงว่าการฝึกสติเนี่ยเข้าไปอยู่ในระบบของการศึกษาในโรงเรียนนี้อยากทราบว่าอันที่เขานำมาให้เราดูเนี่ยเป็นการทดลองหรือว่าในขณะนี้เนี่ยในอิสราเอลเนี่ยใช้เรื่องของสติเนี่ยเข้าไปในโรงเรียนมากน้อยแค่ไหนแล้วนะคะในระบบการศึกษาทั้งหมดหรือว่ายังเป็นแค่เพียงการทดลองอยู่นะคะเราก็รู้สึกตื่นเต้นนะฮะที่ได้เห็นแล้วก็คิดว่าโรงเรียนในเมืองไทยเนี่ยน่าจะมีโอกาสทำอย่างนี้ได้ง่ายเหมือนกันแต่ว่าpresentation ของ professor เนี่ยก็ทำให้คล้ายๆกับทำให้เรานึกขึ้นได้ว่าเรามีสิ่งนี้อยู่นะแต่ว่าเราอาจจะยังไม่ได้ใช้นะคะค่ะขอบคุณค่ะ
ขอบคุณค่ะMay I have the privilege to translate to Dr. Nimrod? Although I don't think it's necessary because you can also speak directly to him. But anyway, Ajahn Prapapat said firstly that she's impressed with the knowledge that you shared today. and she thinks that actually we already have in the Thai education system, but maybe we haven't applied it into the system. But then she has the question if the knowledge or the know-how process that you share today, is it already applied into the Israel education, or is only the experiment at this moment?
So the question was if it's more applied in Israeli education.
Right now.
Okay,
yes.
right now. Not officially yet, but you can see many sparks in Israel. I teach teachers and kindergarten teachers, so it's more in kindergartens in different ways. And I'm not the only one anymore doing it. So there are maybe 3 or 4 similar operations in Israel. Then in primary school we have 3 operations, 3 project leaders, not only me, in primary school. We have more work only beginning in high school, and even more work now done in universities. In Haifa University, in Tel Aviv University, in a Kibbutzim Academy for teacher training, in another academy in the north in teachers training. So it's now getting into teachers training, not only schools or sort of postgraduate for teachers. I teach also therapists working in schools under the Ministry of Education. So it looks like there's a growing curve, even if it's not officially declared yet.
Thank you. ขอไมค์ด้วยนะคะ
Hi, thank you for the presentation. I really was so impressed. I don't know what I'm asking, but let's see. We talk about positive aspect of holistic learning. What about let's see? The students may carry sense of deficiency in themselves, lack, and what about this addressing with the students as a part of mindfulness program? I mean, do you do that, and is that important in your opinion? Did I make myself clear? Yes. Yes. Essence of the question is it important to also look into the students' sense of deficiency, sense of lack in themselves? Is it important to, I guess this is a loaded question, is it important to be honest, help them honest?
The way I think, as a therapist, your question, I think, if I understand, relates to the student's low self-image,
Right.
which is an image.
Like,
So it's tricky. We need to. We cannot argue with the image. The student thinks it's a thought that he is not capable. That does not mean that he is incapable. Now, sometimes students are incapable, and we have to address that. Mindfulness resonates with very simple human capacities. So it's not difficult for someone who thinks he's no good, or sometimes one think that he's too tall, or too fat, or too stupid, or too ugly, and all that become a box, negative box for that student even to learn. So mindfulness resonates with something underneath. Everyone breathe. Everyone has dreams and hopes. Some students are wounded, like they have trauma in the past, and mindfulness may not be enough to address it. They may need more personal attention, with or without mindfulness, to address their woundedness, But even woundedness, usually we have in therapeutic. I'm borrowing from therapeutics. Even now, all of us as human beings, we bring to this room our own woundedness, our own sensitivities. We bring it into the room, consciously or not. We also bring our strength into the room, lots of strength in the room. And we bring our yearnings, our hopes to the room. Each child have these three: woundedness, sensitivities, strength, resourcefulness, and hopes. And we need to find a way into those layers which are regardless of what one thinks about oneself.
Yeah. Can I just make yeah, so in that sense, this mindfulness done at the deep level would help students have that capacity to even question his own beliefs or, the image, false, all this is traumatic stuff that got lost.
If we incorporate the dialogue, not only mindfulness when I close my eyes as I sit or as I lie down, and then I begin studying and I'm more relaxed, but there was no communication, no dialogue. Right. Mindfulness is a monologue. It could be. We speak to the student, or I guide you to any mindfulness experience. That's a monologue. But the more dialogue we have, and the more safe space we have for them to express themselves, then we'll find out about him or her, and a healing can take place.
Yeah, that's why that inquiry, compassionate inquiry,
exactly,
with the awareness in the body, the somatic awareness,
exactly,
makes the change.
Yes, so that's the strength of inquiry. An open space, safe place for everyone to say one's truth.